The most common injuries that I actually treat are related to knee and shoulder injuries in the workplace because I do a lot of work-related compensation injuries. My greatest injuries are rotator cuff injuries, labral tears about the shoulder, anterior cruciate ligament injuries, meniscal tears about the knee. That's the most common injury. They're usually referred, first of all, to us because they've had an on-the-job injury. Of course, the insurance company, the adjusters, the employers all want my opinion as to whether it happened on the job and whether the injury is related to the job. So that has several factors. What the history is, what the clinical findings are, whether the history is consistent with the injury that we're treating. Did they have pre-existent disease process? Did they have previous surgery there? So it's multifactorial, to say the least. And it has taken many years to kind of balance those factors out, to understand what really truthfully is or was a work-related injury. The great benefit is we have the case managers on site most of the time. And I know most of them. I've been working with them for 20 or 30 years. So they know how I take care of patients. That's, I believe, one of the reasons they bring patients to me, is that they know I care about the patient, I take the time and I listen to them. And they also know that I will direct my care to get the best and quickest outcome, and that if I can't get an appropriate outcome, it doesn't stay prolonged. One of the things adjusters don't want to see, or employers don't want to see, is someone that just is left hanging, so to speak. That term is bad, but left hanging for months at a time, going nowhere. I mean, we try to make them better. We do everything we can. We maximize our benefit, and then we try to tailor their limits to where they're at. If they can't get back to work, which occasionally that happens, then we define their limitations and we give them some permanent restrictions. In treating a work comp patient, I want them to feel like they're not in my office any different than any other patient. I try to treat them with the same respect, do the same examination, and treat them exactly the same. I want them to know that I care about what their injury is and I care about getting them back. So my care in the work comp patient is no different than any other patient I see in my office. I don't work for an insurance company. I don't work for the employer. I work for the patient. And they send them to me because I've done this for a long time and I have good outcomes, and they know the details of doing workman's compensation is very complex, and our group has learned to do it very well.